pleasure to introduce Honorable Cyrus Engerer, who is one of our MEPs in Brussels, and he's also a member on the EU Parliament Special Committee on Beating Cancer. Some weeks ago, Honorable Engerer approached us in order to see how we can work together in order to be able to influence future legislation, European and local legislation, in order to try to beat this cancer problem that we are facing. Honorable Engerer, I leave it into your capable hands.
Thank you, Professor Grech, and I would like to thank you as a national platform for inviting me to the conference on World Cancer Day 2021 in different circumstances to what we are normally used to. Cancer is a disease that touches each and every one of us during our lifetime, if not directly, through our loved ones and our colleagues. According to statistics issued by the World Health Organization, on a European level, 3.5 million people are diagnosed with cancer every single year. As you might know, and as Professor Grech mentioned in the introduction, I have recently been elected to the European Parliament, and the group of progressive socialists and Democrats have entrusted me, first of all, with the committee that takes care of the environment and public health. And during this year, during this mandate, where a special committee on beating cancer has been set up, I have been entrusted to be the Maltese member of the European Parliament representing the Socialists and Democrats within this important special committee that will be working in order to influence all the other committees with regards to work that could be done in order to reduce the incidence of cancer across the European Union. However, I'll have more time as we go along today to delve into more deep understanding of what this committee is currently working on. Having been entrusted with public health and beating cancer, I embarked immediately on a number of meetings with Maltese professionals, as well as other persons coming from the medical field, whom I would like to thank for their invaluable work for the Maltese and Gozitan patients. I also started meeting with a number of NGOs who provide crucial support to patients and their families. My aim ultimately was to become more aware of the current situation in Malta and Gozo so that I could represent in the best way possible the views and realities of the country I come from at the European platform. The challenges in the field of cancer continue to increase globally. Physically, mental, and financial challenges on patients, their families, as well as on our health system, and a reality across the whole wide world. Apart from the usual challenges, this last year obviously has come with an extra layer of challenges. And as we have heard through all the speakers throughout this morning, this has added extra layers of challenges to cancer patients, as well as those who are caring for patients. In view of the immense pressure on hospitals caused of COVID-19, we have seen people having their treatments postponed or rejected across the world. Moreover, COVID-19 managed to also increase and directly affect patients themselves, since it poses a higher risk to cancer patients, especially those receiving medicines and treatments that affect their immunity, their immune system. Apart from the stress and challenges triggered by all these factors, patients and their immediate families are also facing all of this without their usual support systems. As we have heard this morning by Rowena and others, the fear of the consequences that could ensue if a cancer patient unfortunately also catches the virus COVID-19. Not only are patients living in fear of the virus, but they also have to go through cancer without being able to rely on the physical comfort that their loved ones usually give to these patients, and without being able to go through this experience without the support systems that are in place, both at a national level, at a community level, and the support system that each patient would build for him or herself. That said, I am an optimist and prefer to draw on some positive elements from this challenging year, which can help us in the fight against cancer. To start with, we are aware at a European level that over 40% of cancer cases within the European Union are preventable. By strengthening prevention systems, we can increase survival rates, thanks in part also to early detection systems that are already in place and that we can put in place thanks to new technologies that are evolving in relation to this disease. As reported by the World Health Organization, many health systems in low and middle income countries are the least prepared to handle the burdens of the disease itself, and a large number of patients with cancer globally do not have access to timely and quality diagnosis and treatment. On the other hand, in countries where health systems are strong, the survival rates of many types of cancer are improving thanks to early detection and quality treatments and care. And I am glad to see, even from statistics, that Malta, our country, is managing to have good survival rates when compared to other European member states, but obviously we must continue to work in order to reduce these numbers nonetheless. The discrepancies that exist between member states of the European Union, for example, in terms of per capita cancer expenditure, where we see substantial variations between countries, is one of the things that must be addressed in a European Health Union perspective. According to statistics, for instance, in 2018, more than €600 per capita in this area was used in Luxembourg and Denmark, which were at the highest end of the spectrum. At the same time, Bulgaria and Romania, for instance, spend more or less €80 per capita on cancer expenditure. Here is where I make a link with what I was saying earlier. At a European level, we need to have a common plan between member states to fight cancer, to address these inequalities between countries, and to reduce burdens on patients, their families, and the health systems. We need to come together for more support and cooperation at European level. Notwithstanding the challenges, we are noticing that this area is increasingly being given priority in Europe. In fact, the fight against cancer has been chosen as one of the priorities during the term of this European Commission led by Ursula von der Leyen, in the context of a proposal for a European Health Union. In fact, in this regard, yesterday, I'm sure many of you have followed that the European Commission presented a new plan to fight cancer at a European level, the so-called Beating Cancer Plan. This plan sets out actions for the European Union to support, coordinate, and supplement member states' efforts at every stage of the disease, including in prevention, early detection and screening, treatments, and care, as well as the quality of life of patients, survivors, and the quality of life of carers and the medical professionals who are as important in this fight as everyone else who is also going through this experience on a personal level. In addition, within the European Parliament, as I mentioned earlier in my introduction, a special committee for the fight against cancer was set up last year, of which I am a member. Our mandate for this committee's first term is focused primarily on drawing up a number of concrete recommendations to the member states and other European institutions with a view to strengthen resilience against cancer. These recommendations will focus on a number of challenges in this area. First of all, a common front for the fight against cancer between member states, access to screening for undiagnosed people, support for caregivers, access to innovative treatments, and the care for children facing this disease. Furthermore, we shall be feeding all other European Parliament legislative committees with facts on what could be done in each committee to prevent cancer and scale down the numbers. As I said, I want to represent the Maltese sector in the best way possible within this committee. Therefore, during the last 3 months, I have embarked on a series of meetings with all those who, in one way or another, touch on work related to cancer in our country. And I thank all of those who found some time for the many virtual meetings we had, and thank you for sharing your knowledge with me, as well as stories that you have experienced that are undoubtedly inspiring to many. I admire the fact that much of this work is done in silence and with not much recognition. So allow me to call you the unsung heroes in this field. You are heroes not only for the patients and their relatives, but also for our society, because you are managing to achieve one of the best survival rates for Maltese patients across all of the European Union. In the sense, I wish to invite you and not hesitate to contact me should we not have already held a meeting and discussed the issues that are of interest to you. Hearing from all of you is very important for me to be able to conduct my work in the European Parliament and convey your thoughts and realities at a European level. As I said, hearing from you is important, enable for me to be able to put forward and represent as best as possible the needs of our country in this field at a European level. We have in recent surveys seen that European citizens, as well as those in Malta, we are not an exception compared to all the others, people want greater collaboration between member states in the health sector and want the European Union to safeguard their interests and their health. What we saw, for instance, last year in March, where we saw countries like Italy trying to fend for themselves while being inundated with a large number of COVID-19 cases where the country could not manage on its own. We have seen the response of people wanting more Europe in the response of a European Union when it comes to the response in pandemics, the response in the health sector, and we are seeing this also in response to other diseases like cancer, for instance. In fact, this need for a joint European effort particularly stands out in the context of COVID-19, as I have explained, and similarly to what was done in that context for the joint negotiation and procurement of vaccines that are gradually now being distributed throughout the European Union, we can also use the same approach for our fight against cancer, and that will be my message at a European level today, as we will be meeting the Health Commissioner later on in the afternoon in the Beating Cancer Committee. I believe that we can see better results across the European Union if in this area we work together. This has always been the European Union I have always believed in, a European Union that brings together 27 member states at the moment that work together to address common challenges that affect each and every one of us. I firmly believe that such cooperation at a European level in this field and in the field of health in general will bear fruit, not only at a European level, but also in our country to ensure further progress in the fight against cancer. Thank you once again for inviting me to be part of this important and very interesting for me webinar. And I hope to see you again during this year, but also next year when we will hopefully be able to have another gathering, another event, this time physically, where we could also discuss together the way forward and the lessons learned from these 2 years. Thank you once again.
Thank you, Honorable Engerer. We are a national cancer platform, and obviously we represent different NGOs who are working daily with cancer and cancer patients and their relatives. As you well know, in most European countries, patient groups form a very strong lobby. Unfortunately, here in Malta, we are nowhere as effective as other European countries. How do you think we can collaborate as NGOs in order to make our voices better heard at a European level? Honourable Engerer?
Yes, I'm here. I think that one of the best approaches, apart obviously from joining European-wide lobby groups that work in this area, I think that the Beating Cancer platform within the European Parliament can serve as an opportunity for Maltese NGOs. And this is one of the things that I would like to do in this mandate. Basically, in the Parliament committee, one of the things that we're doing on a weekly basis is hold public hearings where we get a number of medical professionals as well as experts in the field coming from NGOs, people who not only work in the medical field, but also those who offer support services to share their experiences in the European Parliament so that European parliamentarians can hear and listen to the experiences of these people and be able to formulate a better policy when it comes to our work in the health sector and also in the cancer field. So my advice firstly would be on the importance of Maltese NGOs to join their European umbrella organizations. European umbrella organizations have a very strong lobby here and are able to enter the European Parliament whenever they want. They have access, they find open doors, as would anyone else. But when it comes to umbrella organizations at the European level, they also have access to enter the building without requesting prior the prior go-ahead, let's say, from Parliament each and every time they enter. Secondly, and that is why I wanted to hold as many meetings as possible in these first 3 months with as many NGOs as possible in Malta and Gozo, I can act as a bridge between the NGOs and medical professionals in Malta and the Cancer Committee. In fact, I have already asked for a list of the next meetings that we're going to have here in Brussels with regards to the Beating Cancer Committee, and I will be proposing to the committee a number of Maltese NGOs and a number of Maltese medical professionals in order for them to come to the committee. Obviously, at the moment, most meetings are being held virtually. Hopefully, later on this year, we will also start having more physical meetings so that Maltese professionals and NGOs in this field could give a perspective, a direct perspective, let's say, of the Maltese reality. I do speak on behalf of all the Maltese when I'm speaking in the committee itself, but it is always important to listen directly from professionals in the field who touch and live this experience every day and who are definitely in a better position than myself to explain in detail what Malta is doing in this regard. For me, for instance, it was very interesting to learn in the past 3 months a number of statistics that show Malta as where we differ, let's say, from the rest of the European Union, or where we differ and other countries differ between each others when it comes to some cancer that is more prevalent, for instance, in Malta than in other member states. On the other hand, we have a number of cancer areas in which, as a country, we have better success rates than other countries. And for instance, when it comes to children and care of children who have cancer, as well as breast cancer rates, which are quite good compared to some other countries within the European Union. Obviously, having you there in the committee would definitely help each and every one of us to understand even better what is happening in our country.
Thank you, Honourable Engerer, you are the only politician in our panel here. So I don't know whether you can answer this question, but I am still going to put a question that was put on the chat. In Malta, most of cancer patients can only avail of cancer treatment, especially new standard therapies, through financial support by a charity institution, namely the Malta Community Chest Fund. And this is a never-ending problem. Newer drug treatments for oncology is the norm. And nowadays, every year, there are a lot of products which are put on the market, which show a favorable outcome to a particular cancer. The main problem with these is their cost. And obviously, some of the treatments are within the national health system here in Malta, others are not. And in those particular instances, patients, on the advice of their attending doctors, opt for this new treatment, but they have to fork out the expenses themselves. And not everyone is comfortable enough to be able to afford them. And so they have to obviously go to other institutions. And the Malta Community Chest Fund has a very important role in this respect. I personally do not think that we should rely on a charitable institution. Yes, a charitable institution does that good work, but is it the right way to go around it? How do you think at a European level this could be addressed? You mentioned that if we look at the situation as regards vaccines, at any European level, everybody has agreed and they got a better price. Can something similar to this be done as regards cancer treatment, chemotherapy treatment?
Yes, in fact, part of the Beating Cancer plan that was yesterday announced by the Commission speaks of new ways in which the European Union as a whole can work together between member states and more cooperation in order to advance the way that cancer treatment is given in different member states. We believe that we should always aim that all 27 member states manage to get the highest standards in treatments possible. And in fact, this is what the plan is speaking about, and not only the plan on its own. I will refer to it once again. The European Commission, following the COVID-19 pandemic and what happened last year, is looking at launching for the very first time a European Health Union. A European Health Union in which at the center stage of such a union, there would be the patient and the patient's needs in order for the European Union to address this directly and see that each European Union patient, wherever the country, wherever the region, wherever the city or village that that person comes from, will be given access to the best of treatments available and possible within the European Union. In fact, the plan also speaks of a number of funds that will be directly directed at cancer and research, innovation, and the treatment of patients within all of the European Union member states. In our country, I must first of all give thanks and acknowledge the huge work that the Malta Community Chest Fund Foundation does together with His Excellency, the President of Malta, George Vella, who do, and all the previous presidents in reality, who do an extremely good and positive job when it comes to helping out all those who are suffering, going through pain or injustices, and that is a very good thing. However, yes, I think that even at a local level, at a national level, we must address the way that we procure medicinals and treatments. This is not the first time that I am delving into this topic. Before, earlier on, even last year, I was involved in talks with regards to the way that we procure, for instance, HIV medication, having worked for a lot of years on LGBTIQ rights. And I think that as a country, we need to look forward to update the way in which we procure our medicines and our treatments, because while it is obviously important to make sure that there are all the checks and balances that a democratic society should have in order to ensure good governance, at the same time, we must have a system that would allow for the best and most advanced technologically advanced medication and treatments to be made available to Maltese patients in whatever area we are discussing, be it cancer, HIV, or any other health condition that a person might have. What I want to see in this European Health Union, and what I will be working on within the Public Health Committee, is a European Health Union that gives patients the right to access treatment all across the European Union should that person need that kind of treatment. In the sense that, yes, today we have the European Patients Charter, which is important and which was a step forward. We need to see now that this European Health Union will strengthen the European Patients Charter, and apart from that, seek other ways in which member states can work together. The way we have done and worked on the COVID vaccinations is, I believe, a very good first step in the direction that I would like the European Union to take in the coming years. Being a small member state and being a small country in itself leads to a number of difficulties when it comes to a number of areas. Obviously, there's economies of scale. Apart from that, we are at the periphery of the continent. We are also surrounded by the sea, and we do not have that direct link, let's say, that direct access to the rest of the continent by car. We're an island, and we must work to see that we can minimize as much as possible the disadvantages that we have because we are a small island at the periphery of the European Union. So yes, I look forward to a European Health Union in which there is more joint procurement of medicinals for all of the European member states. And that is what the plan launched by the Commission yesterday also speaks about. So I am very positive and optimistic of the future. Sometimes, unfortunately, the European Union moves forward. Maybe it's human nature. We sometimes do it in Malta as well. It must be human nature, where we change our practices, we change the way we work in according to what we would have experienced at particular moments in time. And I think that this pandemic, maybe the pandemic's silver lining is that we are learning and we have found out new ways on how we can work together in the health sector, which till today, the health sector is still a member state competence on its own. We need more shared competence between the member states and the European Union itself.
Thank you very much, Honourable Engerer. One last question, hopefully.
Sure.
Some of our patients, especially the young ones, who are cancer patients, but have stopped their treatment because they're into remission and they have survived cancer, still have problems in procuring loans, in carrying on with their lives. I think that this has got to do with the right to be forgotten. What do you think about that law, and where is it, or do you know where it is in the Maltese legislation?
Apart from the right to be forgotten, I would focus more actually on current legislation with regards to insurance practices. And
I was repeating a question put forward by one of our participants.
No problem. Basically, in the Beating Cancer Committee, as well as in the Public Health Committee, we're working on this very strongly. Obviously, we are 7 different political parties in the European Parliament. starting from the extreme left to the extreme right, and there are a number of divergencies on the views of such policy. However, even the group I come from, the group of Socialists and Democrats in the European Parliament, we're working very strongly on this, and irrespective of being forgotten or not, let's say, each former patient should be allowed and eligible for insurance policies and loans. And that is what we're working on. We're very strong on this, and I will be very strong on this in the coming weeks and months as the discussion progresses, specifically with regards to this topic. I believe that, and I have seen this, sorry to draw the parallels once again, but I have seen this already before when we were working on the rights of LGBTIQ people, for instance, in Malta and across the European Union and the world, where they were discriminated when it came to loans, even if they had always had negative diagnosis, for instance, of HIV or other sexually transmitted diseases, they still were discriminated for a number of years. And I believe that that is unacceptable. It is unacceptable when it comes to HIV treatment. It is unacceptable when it comes to former cancer patients. And we must ensure that such discrimination at an EU level is totally removed, and that no member state could allow such discrimination in its national system and national laws. It is something that I hold very much to heart, and it is something that I will be very vocal on in the coming weeks and months as we discuss these issues with a number of legislative proposals and non-legislative proposals that we have at a European Parliament level. I believe that this is one of those topics that NGOs, both in Malta and across Europe, should focus on, should speak on very loudly, should make their voices heard clearly, because I say once again, it is unacceptable to have people who would have already gone through very difficult financial and economical hardships in their lives to be once again be beaten, let's say, metaphorically, with a number of regulations that banks and insurance agencies might have. I must say, not every single political party in the European Parliament agrees with what I'm saying. We see that those that are at the center right or more right of the political spectrum tend to usually be more vocal with regards to the rights of insurance companies and banks. So it is very important for yourselves to be very vocal, and I will be as vocal as you in the coming weeks and months on this particular topic.
Thank you very much, Honorable Engerer. It was a very interesting presentation, and thank you for answering our queries.
Thank you for having me.
Thank you. Our pleasure. Hope that we can collaborate